So the Trump administration just announced they're linking Tylenol use during pregnancy to autism. And my first thought was, hold up, let's check some basic math here. This is peak timeline confusion territory. Here's what actually happened historically. The term autism was first coined by Swiss psychiatrist Eugen Bleuler in 1911 to describe symptoms he observed in schizophrenia patients. Leo Kanner later separated autism from schizophrenia as its own distinct condition in 1943. Meanwhile, Tylenol wasn't even invented until 1955 by McNeil Laboratories. So we're supposed to believe that a condition identified decades before a medication existed was somehow caused by that medication? That's like blaming smartphones for the sinking of the Titanic. The recent HHS announcement claims pregnant women should avoid Tylenol unless they have a fever, citing potential autism links. But here's where science gets interesting versus politics. Multiple major health organizations, including the FDA, maintain there's no proven causal link between acetaminophen use during pregnancy and autism. Recent studies from Harvard and Mount Sinai do show statistical correlations between prenatal acetaminophen exposure and increased autism risk. But correlation isn't causation, which apparently needs to be tattooed on every researcher's forehead. Women who take pain relievers during pregnancy might be dealing with infections, fevers, or other health issues that could themselves affect fetal development. The scientific community is basically face-palming in unison right now. The Autism Science Foundation issued a statement calling this premature, and Kenvue, Tylenol's maker, dropped nearly 10% in stock value after the announcement. That's some weapons-grade market panic right there. What makes this especially frustrating is that autism has clear genetic components and typically develops in the womb before most women even know they're pregnant. The idea that a pain reliever could suddenly flip some autism switch contradicts decades of neurodevelopmental research. The proposed treatment? Leucovorin, a folate derivative which also lacks solid evidence for autism treatment. We're essentially getting medical policy based on preliminary studies that haven't been replicated or peer-reviewed thoroughly.
Please don't forget to like and subscribe if this helped you separate science from political theater. The verdict? This announcement feels more like political positioning than sound medical advice. While some studies suggest correlations worth investigating, declaring causation without definitive proof puts pregnant women in an impossible position. If you're pregnant and concerned, talk to your actual doctor, not a government press release. Science doesn't work on press conference timelines, and autism deserves better than being turned into a political football.